I'm going to demonstrate how to do an intraosseous insertion or IO insertion. So first of all, I have my gloves and goggles, and I'm going to make sure that my scene is safe. For this example, we're going to use a pediatric patient, and first thing we need to do is explain to the parents what it is that we're doing. So explaining that we're basically putting a needle similar to an IV into the patient's bone so we can give them medications or fluids. So we also need to ask the parents if the patient has any allergies before we do this and before we give any medications. And so for the demonstration purposes, I've already spiked my bag. I have a normal saline 1000 bag here, and we also have it inside of a pressure infuser, which I'll explain later on. And the tubing is already flushed and it's good to go, and it's diced. Going through our equipment here, we have several needle selections. So first we have the pediatric needle, which is, as you can see, they're all the same gauge, so they're all the same diameter. They're just different lengths. So the pediatric one here is for 3 to 39 kilograms, and this is a 15 millimeter needle. The next one is for your standard adults. This is a 25 millimeter needle and used for over 40 kilograms. And this last one here is also for over 40 kilograms, and it's going to be used especially for patients with excessive tissue, excessive fat tissue, and also if you're using it for a humeral head insertion. So indications for LA County specifically include cardiac arrest, poor perfusion, severe burns, and any extremis patient where you can't get an IV. Contraindications include fracture of the same bone that we're inserting, previous attempt in that same bone within the last 48 hours, and an infection at that site. Any prosthetics, knee replacements, or any major surgeries where there's any plates or rods, and if you're unable to locate the anatomical landmarks. Those are all contraindications. So for this patient, we're going to say that he's approximately 5 kilograms. So let's go ahead and select our equipment here. So we have the pink IO needle set here, which is the 3 to 39 kilograms. And this is the 15 gauge, 15 millimeter needle. So I'll pull that out. And it comes with a few different pieces of equipment. We have the needle. We have the extension tubing for the flush. We have a wristband that we're going to put on after insertion, a sharps device, and also our betadine for cleaning the site. For landmarks, we have two choices for LA County. We can do the proximal tibia and also the humeral head. And for National Registry, we have 4 choices. We can do those 2, as well as the distal tibia and the distal femur. So moving back to our equipment, we just have a few things to set up. First of all, we're going to attach our flush and make sure we get all the air bubbles out. And now we're going to select our insertion site. So for the pediatrics, our only choice is the proximal tibia. So feeling the patella, we're going to run our fingers down, and on the tibia you'll feel a prominence or a bump. That's going to be the tibial tuberosity. From there, you're going to go about 1 centimeter down and 1 centimeter medial. And from that point, you should feel a nice flat portion of the tibia, and that's going to be our insertion site. So grab your betadine, make sure you squeeze it and break the glass, pull it out, and we're going to clean it with concentric circles. And typically you want to let the betadine dry, so try and do this as early as possible. Next, we're going to make sure that our drill is functional. So test it and attach your needle. And these just have a little magnetic tip on them, so you just simply put it on and it'll stick. And just make sure that this needle is completely attached and tightened down. So after this is dried, we're going to go ahead and stabilize the leg. So you don't want to put your hand directly below the insertion. So grab right below where you're going to put the needle and try and elevate the leg a little bit, use a little bit of pressure, and stabilize as best you can. Now we're going to take the drill, and the first thing we're going to do is push down through the tissue without actually engaging the drill until we hit the bone. Once we hit the bone, we're going to engage the drill with a little bit of downward pressure until we feel a pop and a release. So push through the skin. Now we're touching bone, and we're going to engage the drill, and with just a little bit of pressure, and I felt a release, I felt a pop, and you can see that the needle isn't even completely in, which is perfectly fine. Now we can take off the drill, unscrew the stylet, and we're going to throw that directly into our sharps device. which it just simply goes inside of here. And we're going to hook up our flush here. And first thing we're going to do is aspirate, and we're looking here to see if we see any yellow or red tinged bone marrow. And you might not see that bone marrow. It doesn't mean that it's necessarily out, so we're still going to flush at this point. And the first thing you want to do, because this is an unconscious patient, we can go ahead and slam about 2 or 3 cc's to try and clear out some of the bone fragments. So I'm going to push rapidly for a few, and then from there on, if it's nice and easy, you can continue on with the flush. And we're feeling around the leg to see if there's any signs of infiltration, like redness, swelling, or any coolness to the touch. And you want to feel around the site and also behind the leg. All right, once it's flushed, we're going to take this off, and we're going to hook up our IV fluids. And we're going to hook this up here. Make sure that if you touch the port, you clean it first. And now we're going to open up our IV fluids. You want to raise this up a little bit, open up the bag, and right now it's flowing well. Sometimes with the IOs, because there's not much space and there's a lot of pressure in the bone marrow, this might not flow right away. So in that case, you're going to use your pressure infuser, and all you do is pump this up, and eventually this tab here is going to pop up and it'll tell you that it's pressurized. So now this is pressurized and our fluids are infusing well. And again, we're going to feel the back of the leg around the site, make sure that there's no infiltration and no signs of any fluid. And moving on from there, we're going to secure the IO in place. So we're going to grab 2 bulky dressings, and let me shut down our fluids. We'll set it to a TKO rate. We're going to take 2 bulky dressings, and we're going to use these to stabilize it, and also so we can see the site to make sure that it's not infiltrating. So we kind of make an upside down V shape, and we're going to grab some tape here and just simply tape above and below. And you don't want to tape all the way around the leg because it could compromise circulation. All right, last thing we want to do is just secure this line so it doesn't get pulled out. So we'll kind of wrap it around and bring it up to the top of the leg. Grab some more tape and secure that down, making sure that our port is still accessible for fluids or medications. And lastly, just reassess the patient, make sure that your therapy is working, and reassess for any adverse reactions. All right, so if for some reason your IO is not working anymore, if it's infiltrated, or if you just need to take it out, simply take off all your tape, take off all the bandages. And we're gonna grab a 10 cc syringe. Make sure your fluids are completely turned off. We're going to disconnect the line here. And with your syringe, twist it on, and we're going to be turning clockwise while pulling outward with a little bit of pressure, and make sure you stabilize that leg. So just twist and pull, and it's going to pop out, and make sure you throw that directly into the sharps. And we're just going to hold direct pressure until the bleeding stops, put some tape around it, and you're good to go.